The Anglican Development Services ADS Mount Kenya East is the development arm of the Anglican Church of Kenya, serving communities in Kirinyaga, Embu, Tharaka Nithi, Meru, Isiolo and Marsabit. It has the primary mandate of social transformation for wholesome and dignified living within communities.
Anglican Development Services Mt Kenya East, we have two main types of projects. We have sustainability projects in our stations, and we have donor-funded projects. And in every station we have at least a donor-funded project and a sustainability project. For sustainability projects, this is where we have our own projects and be able to complement the donor-funded projects in terms of being able to raise more funds from our sustainability projects and meet other needs in the community or even in the organization.
When it comes to sustainable programs, ADS Mount Kenya East has prioritized the provision of healthcare services.
We are now very happy that in all the counties we have health facilities, and we are so happy that people are able now to access those health services so close, other than going for referrals in Nairobi or in other areas. When you look at the way the ADS started with the community health, and the main way of doing so was to build the capacity of a few members of the communities. Then they were called the community health workers, so that they could work with the communities and address issues of health among the communities. We now have established health facilities with all the medical expertise that is required.
ACK Mount Kenya Hospital in Kerugoya, Kirinyaga County is one of the health facilities under ADS in Mount Kenya East. The health facility, which is registered as a level 4 hospital, has an inpatient bed capacity of 150. In outpatient, an average of 90 people seek medical services daily.
We have the pharmacy, we have the clinical services, we have the emergency unit. So there is a systematic way of how our patients will come in, so that you can avoid a lot of confusion. We have the best machines that we can be able to screen our patients in the laboratory. Then from the laboratory we have the X-ray department or the radiology department. We have a referral system where we can be able to communicate to other higher hospitals or depending on the service that we require, and then we take the patient there. We have some arrangement with consultants whom we have picked according to their capability. For example, the ENT, we have the surgeons. Currently we are having the laparoscopic surgeries, the gynecological ones. We have a gynecologist by the name of Dr. Jagi, who is offering laparoscopic surgeries. And that one has helped us to offer services to a very higher level. We have our theatre, which is also a 24-hour service. We have doctors who are on call throughout. So our services are 24-hour services.
In pursuit of better healthcare services, especially for patients with renal diseases, the hospital has invested in a renal unit.
We do dialysis, we do counseling, both for diet. We also do counseling for the process and the procedure for dialysis, that is the catheter insertion for hemodialysis and the dialysis itself. So our session starts at 6 a.m. very early in the morning. We come prepare the machines. The patients come in. Sessions start at 6:30 or 6:20 thereof. Our session takes 4 hours. In between the sessions, we do have maintenance of the machine. We do some rinsing just to check if the machine is okay and prepare for the next session of dialysis. So we have 2 sessions during the day, and the 2 trickle to late in the evening to at night. All these patients, most of them used to go far away to get dialysis, some in Embu, some in Nyeri, some in Nairobi, in Kenyatta. So Having opened the renal unit in Mount Kenya, Kerugoya region, we are having patients coming from those ones who used to travel far and wide. We had transferees. Those were our first initial patients coming from Embu, Maua, Nyeri, and they all came at least near home because they were coming from the locality. We accommodate both those ones who are working, the school going, we give them the sessions accordingly, and we cater for them wholesomely. We are having a physician. Our plant is well taken care of. We have quality care. The water is up to state and up to standard. The staff here work hand in hand together with the patients to ensure that they are well catered for.
The renal unit, which has been equipped with ultra-modern machines, has given the renal patients great relief.
I have been attending the sessions 2 days per week, and we are getting proper services in this hospital. The cooperation between the patients and the nurses is good. We are getting good diets. They are working like ants, where each and everyone is united with one another. I'm being catered by the NHIF card. So I used to pay for the card 12 months. And if I've completed paying the 12 months, that card will cater for me for 1 year.
Renal unit is a specialized service, noting that there are very many cases of kidney failures around. Here before used to transport our patients to Nairobi and other far-fetched places. But currently, the demand has grown, and we are also feeling good that we are able to serve our patients who are in need. We are on the process of procuring 3 more dialysis machines, and we are waiting for the deliveries.
In Wangoro town, one of the busiest towns in Kirinyaga County, ADS Mount Kenya East has also put up another health facility.
We have an outpatient services, the inpatient services. We also have an active child welfare clinic, stroke ANC services. We also have a well-equipped pharmacy that we have a variety of drugs, and so we make sure that at least we serve the needs of the patient. We don't need to prescribe and see them and have to prescribe to them and go purchase the drugs to the outside. We also have a well-equipped laboratory which offers a variety of tests to help us in the diagnosis of the patient's needs and the ailments. We boast of experienced, quite friendly staff. Our care is patient-based. As a faith-based organization, our drugs are subsidized. Apart from just treating our patients, we help our clients understand that prevention is key than just treating, such that if they are back at their community levels, they can also help us educate other family members and the community.
We also have introduced outpatient medical clinics, which target the people with chronic illnesses, non-communicable chronic ailments such as hypertension and diabetes. So these clinics, we do them 2 days in a week, that is Wednesday and Friday. Also, we are introducing maternity services. We have established a ward which is new, and now we are in the process of equipping so that we can pick the services for maternity. We are also having plans of having a theatre, so that is the next project. And we expect now with a theatre and expanded ward of that 7 beds, then the hospital will be able to run well and attend to the needs of the patients.
The facility, which is NHIF accredited, could not have come at a better time for Maua residents.
Wakati nilikuja hapa, niliuliza kama kadi inaweza fanya kazi hapa. Wakaniambia inaweza fanya. Sasa kutoka hapo nilikuja nikaingia, wakaniingiza kwa system. Na nikaona ile services wananipatia ni sawa sana, na nikafurahia sana kwa sababu hata huko kwingine sikuwa napatiwa services kama hiyo. Mpaka saa hii tunaendelea na wameng'ang'ana kabisa, services zao naona ziko sawa kabisa.
From Kirinyaga to Embu County, where ADS Mount Kenya East is taking healthcare services closer to the people. In Bere South, Kiritiri Town hosts Mayori Dispensary.
Other than being in the rural areas, you find that here people can come for their services, at least when they are shopping, and you find that people love it because it is within the town, and it is easily reachable. We, being a faith-based organization, we are committed to give the best services and quality services. The drugs we have, we are drugs from trusted sources.
When we came to Kiritiri town, we never had our own place. So we decided to hire a place where we can keep that clinic. Now we have grown from that hired place. And now from there, we were able now to buy this place and where we have done this construction. Now we will be able to move from the hired place to our own. So that now the money that we have been paying there, now it can help us now to do other things in this new site.
In Tharaka Nithi County, it's another busy day at Metongo Dispensary.
We have the clinic, which is taking care of the well-being of the community around this area. We have a CEO, who is the clinic in charge. We have a registered nurse, who is in charge of MCH, and also we have our laboratory technicians. Due to the public demands or the high number we are receiving here for our clinic, we've decided to convert our hostel facilities into male and female ward.
About 2 hours drive from Metongo past Meru Town, ADS Maua Station apartment stands out in Maua Town. This is home to Maua Health Facility under ADS Mount Kenya East.
Currently, we have 3 departments. We have the department of clinic, we also have pharmacy, and also we have the laboratory. Usually what we usually do after seeing the client, we send them to laboratory, or there are those whom you just prescribe, and they pick drug directly from the pharmacy. We also have some other services, especially MCH and family planning, whereby we see the expectant mothers and also immunize the under 5 years children.
The plans we are having here is that we want to go on with the health facility. We want to start an inpatient, whereby we need to start with the maternity, and we have rooms that we can right free start the maternity services. But thereafter, we are hoping that we will also raise more money to be able to put up a story building in terms of wards, which can facilitate us to be able to have the male ones, the female ones, and the pediatric ward.
Farther north in Isiolo County, ADS Mount Kenya East has committed an enormous amount of resources in the health sector.
We offer primary healthcare services for the communities around here. Basically, we offer antenatal care clinics for pregnant women, we offer immunization services, we offer general treatment, we also offer lab services. We also have HIV program for clients that are living with HIV that are able to take care through medication. Well, our intention is to be able to reach more community members with a more comprehensive healthcare package. And one of our focus has been ensuring that you are able to offer maternity services. We also want to look at how we can be able to integrate special clinics, especially for diabetes and hypertension. and so that we are able to serve communities that are vulnerable and that are not able to access those care services from private clinics that are much more exorbitant in terms of pricing.
With the aim of improving maternal healthcare services in Isiolo, ADS Mount Kenya East has gone a step further to strengthen health systems interventions by the county government of Isiolo by supporting Aremet Health Center.
We were assisted by Christian Aid through ADS. They were able to build for us a maternity, which really helped the mothers. They were able to get skilled deliveries. The cases of mothers dying or newborns dying stopped because they were able to come and deliver at the hospital.
This is where we put either the saffron or water to maybe lubricate.
We were supported again by ADS through training of the healthcare workers. They were trained on how to manage obstetric emergencies. That's EMOC for all the health workers working here at the facility. They were able to train the healthcare workers. We had also the traditional birth attendants. After construction of the maternity, it was also equipped. The equipments are there.
The Constitution of Kenya 2010, Article 43, subsection 1, Part A, provides that every person has the right to the highest attainable standard of health, which includes the right to healthcare services, including reproductive healthcare. ADS Mount Kenya East believes in wholesome and dignified living, and to achieve this, better healthcare is key. That's why it's a priority.